Hello, I'm Dr. Manish Singhal, medical oncologist, Apollo Hospitals, New Delhi and Noida. In a patient of myeloma, generally myeloma cells or the plasma cells, they reside in the bones. And when the cells become cancerous, the bones are eaten away. And when the bones are eaten away, the calcium rises. And because most of your cells reside in the marrow, sometimes blood becomes less, that is anemia. Anemia is basically low hemoglobin. The other thing is myeloma cells also produce abnormal antibodies or abnormal proteins. These proteins are filtered through the kidney and can damage the kidney in the process. And hence the serum creatinine level can increase. So the serum creatinine level increases whenever there is multiple myeloma. Sometimes the bones have lytic lesions or the bones can collapse under the weight of the body. So if you do a whole body scan, you'll find a lot of punched out lesions in the bones, or the bones may collapse under the weight of the body. So the symptoms of multiple myeloma can be mostly backache, symptoms of kidney dysfunction or kidney failure, repeated infections. I told you that multiple myeloma is a disease of your immune cells. When the immune cells become malignant, your immunity goes down. So a patient may get repeated infections because of multiple myeloma. Their blood counts or their hemoglobin keeps on falling very rapidly and they'll require a lot of blood transfusions. So infections, low hemoglobin, kidney function derangement or rise in serum creatinine or requirement of dialysis. This should prompt an investigation to rule out multiple myeloma. Bony pains, because the multiple myeloma cells or the plasma cells, which are your immune cells, they reside in the marrow and the bones become weak and then they can crumple or break under the pressure of your weight. So bone pains is a symptom of multiple myeloma, and sometimes because of the abnormal protein which increases in the blood, it can increase the blood viscosity. And when the blood viscosity increases, you can get thrombosis in the blood vessels, and these clots and thrombosis in the blood vessel can travel to various parts of the body. So these are the various symptoms of multiple myeloma.